Heart disease is the leading cause of death in the United States, and February is American Heart Month. So this month's theme is a healthy start to a healthy heart. Our topic this week, an interview with a cardiologist. Let's do this. I'm Dani Lebovitz, a registered dietitian, nutritionist, and fitness enthusiast who loves to eat. Welcome to Dani's Delicious Dish, where we get serious about food, fitness, and living better. Food brings people together, it nourishes our bodies, and influences how we learn, grow, and heal. We're going to take you from the classroom, to the gym, to the market, to the kitchen. All month long, we've talked about heart health with nutrition, fitness, and the life-saving techniques of CPR. Today, we're here with an expert, Dr. Alex Smolensky, a cardiologist, to answer some questions for us to help us live better. What exactly is heart disease?
There is not a single disease about the heart. You need to think about the heart as a car engine. Car engine will have several parts, and you can think of a heart having the pump. Therefore, you can have pump failure or disease of the pump of the heart muscle. You may have disease of the electrical system of the heart, just like in the engine. You may have a disease of the plumbing of the heart, just like plumbing in the heart, in the engine, and you may have diseases of the valves in the heart, just like the valves in the car engine.
What are the risk factors for heart disease?
There are several risk factors. Some of them are thought to be classic, and some of them are somewhat newer on the block. The classic risk factors would be high blood pressure, high cholesterol, diabetes, having several extra pounds on your body you wish you didn't, meaning if you're obese or overweight, being physically inactive, being a smoker, and unfortunately, as we get aged or we get mature, our risk of heart disease slightly goes up.
Is there anything you can do to decrease your risk for heart disease?
There are many sources out there, both on the internet and in the media, where people advocate for certain techniques. In my mind, and I was trained as a preventive cardiologist as part of my fellowship, the best approach is to use the American Heart Association definition of ideal cardiovascular health. It's easy to Google it, you can look it up, but it has 7 components. The blood pressure, whether you smoke or not, whether you're diabetic or not, the level of cholesterol, what kinds of foods you like to eat, whether you have obesity or you're overweight, and the degree of physical activity.
Are there any types of heart disease that are reversible?
Some of them are not, but some of them are, and like most things in this life, it depends on how far along you have gone. For example, the most feared heart disease, which is the disease of the plumbing, the one that leads to heart attacks and in some cases to heart failure. If you catch it early enough, you can for sure stop progression of it if you are extremely diligent about your medicines and your cardiovascular health, just like we mentioned in the American Heart Association ideal cardiovascular health model. Theoretically, you can reverse it, but it's extremely difficult to do it in real practice. The other disease that may be reversed, and it's kind of new in our human society, it sort of developed about 30 years ago, mainly because of blood pressure, the diastolic heart failure, where the wall of the heart muscle becomes thick. And that type of heart failure can be reversed with physical exercise up until about the age of 45 to 50. Once you miss that sweet spot, that's it.
Is there such a thing as too low of cholesterol?
Theoretically, yes, but in clinical practice, you almost never see such a low value that will lead to any meaningful clinical adverse outcome. So for my patients, I tell them if you have an indication to be on a cholesterol medicine, for example, if you have diabetes, or you had any stents placed in you, or you had bypass surgery, do not even pay attention to your cholesterol, just take your medicine.
What are the benefits of niacin and omega-3 fatty acids? Should we be taking a supplement?
Excellent questions. It completely depends on who you ask. Now, if you go by the official guidelines, which are mostly based on good clinical trials, there are no good clinical trials to prove that niacin or omega-3s are beneficial. So, if my patient wants to take omega-3, I will have them do it. If they want to take niacin, I will tell them, well, it's probably not a good idea because the niacin has a lot of side effects, and without proven benefit, it's probably too much.
What kind of physical exercise is beneficial?
It depends on what part of your body you would like to benefit. Because you're speaking with a cardiologist, we probably need to talk about the heart. Fundamentally, there are two kinds of exercise people typically talk about. One is the left weightlifting or something of this nature, and the other is running or the modification of it, like walking, jogging, bicycle, or swimming. This has been looked at in a clinical study, and it was done in a setting of heart failure. What turns out is that if you walk, jog, run, swim, or bicycle, you'll feel better and you live longer. But if you do the opposite, if all you do is lift weights, exactly the opposite happens. You don't feel as good, and your life expectancy slightly drops. And what's truly interesting is that if you can combine both, then one will completely cancel out the other.
That's great. So walking is good too.
I mean, if you read the book Born to Run, it typically implies that walking is one of those things we were designed to do.
Great. And so how much exercise should we get?
If you ask me as a professional, you will get one answer. If you ask me as a human who is a marathon runner, you'll get a different answer. Professional opinion, again, is based on clinical studies, and what seems to be happening, at least based on the data, is that as long as you invest 1 to 3 sessions per week, averaging approximately an hour and a half to 3 hours per week of moderate exercise, you will get the most benefit out of it.
Thank you so much for meeting with us today. We really appreciate it.
Pleasure.
Make lifestyle and behavior changes and protect your heart today. I'm Dani the dietitian. Till next time, live deliciously.